The following segment is sponsored by Northwest Honda Dealers.
We have seen the beginning of a really dramatic change in the way that media is handling mental health crisis and suicidal crisis.
Kind is better. It's not just the name of our youth mental health mission here at K2. It's also a positive way to approach life during the best or the worst of times. Tonight, how the attitudes around our mental health are changing and why experts say it's time for older generations to catch up.
We're definitely noticing attitudes changing about talking about mental health.
It's happening slowly, but the stigma that's kept people from comfortably talking about mental health is eroding.
Stigma plays a big role in us getting better at this.
At mental health support groups Lines for Life and Youthline, they're noticing the changes. Famous people are going public with their mental health challenges, and our kids are clearly more comfortable than previous generations in talking about it.
Kids will say to us, we get classes in sex trafficking and human trafficking, and with this kind of health and that kind of health, why isn't anybody talking to us about suicide?
The fact is, adults are scared to talk about suicide with their kids. There's a perception that doing so could be dangerous, and many aren't ready for the answer. But the truth is, not talking about it is more dangerous. As Gally Murray, Clackamas County Suicide Prevention Coordinator, explains, we need to understand that mental health is a big part of our overall health.
So suicide has a static red line, right? And it's static, and it's over like at least a decade, maybe 2 decades. And then stroke is low, HIV and AIDS is low, heart disease is low, and those rates haven't gone down just out of luck. Yeah. I mean, they haven't gone down just because people got better, because America started getting healthier. Guess what? No. They've gone down because we have been intentional. We've put ideas behind it, we've put energy behind it, because we knew we could do something about it, and that has yet to be the case with suicide.
Stephen Canova, who works for Lines for Life by following up with suicide survivors after they leave the hospital, knows how mental health literacy can save lives. He's a survivor himself. He knows he's living, breathing proof that there is hope for people who are at their lowest, and long-term recovery is possible. But to save lives, we have to ask the question, no matter how tough it is.
It's been a myth in our culture for a very long time. If you talk about suicide, it'll get people to think about suicide, and therefore they will go die by suicide. When the reality is they're already thinking about suicide, and what they need to know is there's help out there.
He suggests if you're comfortable, you could ask, are you thinking about hurting yourself anytime? It could help establish a tone with your kids that you're concerned about their mental well-being. But it's especially important to ask when you're afraid the answer could be yes.
To be aware of the warning signs. If you see a dramatic change in your friend or family member's personality, in their hygiene, in isolating themselves from activities or people that used to bring them a lot of joy, don't be afraid to ask them a very direct question. Are you having thoughts of suicide? Are you thinking about killing yourself? When you do that, you open up the door to have a really honest conversation that doesn't have stigma, because you started it. You used that word we're not supposed to use.
And if the answer is yes, know how to reach out for help. Many of the calls to Lines for Life in Southwest Portland are from third parties, families and friends looking for help for a loved one.
Experts say most mental health crises are temporary and will pass. If you need to talk to someone about it, you can call the National Lifeline 1-800-273-TALK. For youth-specific services, you can call Youthline 877-968-8491. We have all these resources and more on kindisbetter.org. And what will you do to be kinder? As part of a Kind is Better, we've also launched the I Will campaign. The idea is to get people to commit to be kind in specific ways. And you can post what you will do on the Kind is Better Facebook page.
Such an important initiative.
Yep.
So proud that we're doing that.